Well, Dr. Vasquez, let me ask you something. Many of us, and I, definitely say us because I include myself here, and we seem to be lazy going to regularly go to an optometrist the time we should. And frankly, if we go to every doctor the time we should, I'm not so sure we just not only spend time in a doctor's office, okay? And so it's almost understandable and yet maybe devastating. Now, tell us some of the real reasons of why a person should, so to say, come rather regularly. Because the way I see it, you see or you don't see, and you put up with the, let's say, not seeing. And when it gets worse, you go and you get your classes. Maybe you skipped by that time. You have to skip two strengths or whatever. And so what if you, so to say, were willing to put up with the nuances in between? Does it really do any harm rather than being annoyed yourself? And since it's probably the dimmer switch, you get used to it so little, you probably don't even notice it. Anyway, tell us some of the symptoms, some of the things which really show and say and indicate that you better get your butt to an eye exam.
Well, a lot of these things that we detect are symptomless. So that just go on and go on and go on and go on until finally something breaks down, until you're like, wow, that eye is really blurry. Well, why did it become blurry? Because of maybe there was glaucoma there, maybe there's a developing cataract, age-related macular degeneration, or even a benign tumor or a tumor can create those situations. So a lot of times there isn't any outward symptoms that will say, oh, I need to go into the exam. But that's why we would like you to come in at least once a decade to have things checked out, get you look under the hood, so to speak, make sure everything's working properly, and then we align certain follow-ups for certain people. Sometimes that we will extend the appointments out a little bit longer until we get to certain ages, and then certain things just start happening in our 40s or in our fifth decade or sixth decade. That's where the continuous yearly exams are very important, just to detect that. And besides just checking your vision, we also need to check the overall health of the eyes, and that's why it's important to, even though you're seeing well, you can still have glaucoma that's sneaking up on you, and you can be a superior athlete and have great vision, superhuman vision, as I say, but you could have a tumor in your eye, and that's the worst thing you want to have happening to you. So it's a case by case type scenario.
Let's get it checked. So also I have heard that, for instance, an optometrist in an eye examination can find things such as diabetes out of all. I mean, tell us a little bit about it. Why? And, why in the eye? I know that podiatrists find diabetes relatively fast and easy, and actually even dentists. And, but so here now we have the eye doctor who apparently, somebody told me, is one of the most, can find it almost faster than anyone else. Is that true?
Yes, that's very true. Diabetes is a disease of the very small blood vessels. So that's why it happens in your feet. Peripherally, these blood vessels just don't have the blood flow, so it affects your feet, and that's where the podiatrist will find it. And then you have very small capillaries, arteries, and veins happening within your eyes. And if the dynamics of the blood vessels have been weakened because of the diabetes, you're going to have some bleeding happening within the eye. And they may not happen, right in the center of your vision. And they may happening outside your vision and not have any aware of it. And so we have seen that many times just by looking in the eye, and we see a blood leakage or, maybe even a blood clot. And we're like, whoa, where did this come from? You received 20/20. It's like, oh, okay, we need to send you in for some blood workup from your primary care doctor. And sure enough, it's fasting blood sugar was 600. I'm like, oh my gosh. Or where you've had great vision, and all of a sudden, your vision was out of focus. Usually if it's a sudden blurriness happening, who knows what could happen. And diabetes is one of those things that makes your vision change from where it's really good to where it's really bad, and then 2 days later it's back to good. Like, well, was I tired? Was I worked on the computer too long? Is that, you start to do some self-diagnosing. When all it is, we come in, you get your eyes checked on, and then there's some issues we find out, and then we send you off some more testing. So that's where diabetes can just sneak up on us like that.
Well, it makes sense to me because what you just said makes sense to me because obviously the blood vessels are very, 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 thin vessels, and I guess they would get affected relatively first because it's they're so thin and so sensitive. So if something is wrong there, makes a sense that's where it starts, right?
That's right.
Yeah, and then so many of those illnesses, of course, will affect the eye further because, any body part which isn't going all that well will probably affect most other body parts and will obviously affect the eye. Good. Well, all right, so let's go to our eye examines like to most other examines. Because, seeing well looks to me like it is it is a big thing, because now that I do need reading glasses and sometimes, and I look at them in the car because I read my speedometer or whatever it is, I want to see whatever the clock says, and then I forget to take them off, and for a couple minutes I go, what's wrong with this world? It's a blurry world, and then I realize I have my reading glasses on it, so the rest is just kind of like not doing so well. So it's just not seeing well. Well, I hope I will see well forever. Thanks a lot, Doctor.
Thank you.